what's the relationship to personality types and addiction? The like I know, like, sort of the so if we look at the big five personality types, like openness to experience or conscientiousness, extroversion, agreeableness, and neuroticism, like, is there a link that you see between different personality types, or is it far more complex? I'm sure there's obviously a link into the environment and other socioeconomic factors as well, but are some people more inclined to develop an addictive personality at some stage in their lives?
Yeah, I mean, I looked at neuroticism. Was actually part of my PhD. I looked at the interface between neuroticism and smoking cessation, as a personality construct. And there are, I mean, to answer your question directly, I would say there's no, like, I see extroverts, introverts, every kind of personality type you can imagine, and it is not predictive. I mean, the classic ones are impulsivity, sensation seeking, maybe distress and frustration tolerance issues, but it's certainly not predictive. I mean, there are large scale studies looking at certain personality types may predispose you, but from where I'm sitting, really, they're not deterministic, and you cannot simplify it down to that, in my view. Like the whole area of, I mean, clearly impulsivity. I mean, ADHD, for instance, is a construct we would see probably in about 50% of our presentations. And again, where do you draw the line there in terms of, what we find is a lot of those personality factors, for instance, ADHD doesn't change the course of an addiction. In some severe cases, it may make sense to treat an individual, for instance, with medication in that situation. But in the vast majority of cases, all it does, looking at, say, for instance, ADHD, it would bring that personality piece. It would reduce the intensity of some of the issues there, such as impulsivity. But again, the way out of addiction, we would be likely emphasizing mutual support, i.e. meetings, one-to-one counseling, contact with a specialist service, and maybe anti-craving agents, or the use of antaboos, for instance, if it was an alcohol addiction. So what I'm trying to say is the personality factors are not, they're important when looking at the formulation of a particular addiction, but they're not going to necessarily change the course of the addiction treatment.